Hello and welcome, everyone. My name is Alex, and I am the Chief Operating Officer for the Association of Nurses and Nurse Practitioners of BC. So glad to have you all. I want to acknowledge that NNPBC's offices are on the lands of the Musqueam, Squamish, and Tsleil-Waututh people. We're grateful for their stewardship over centuries, and we are privileged to live on this beautiful land that we get to call home. So welcome, everyone. As you can see, this is meeting style. So if you're able to join and be on camera, that's wonderful. It's always lovely to put faces with names if you're able to do that. If not, no problem, totally understand. Additionally, it looks like everyone is muted coming in. But if you can mute just to minimize ambient noise in the background, that's super helpful for everyone as well. And with that, I'm going to pass it over to Fiona, who will take it from here, and we will get started. So again, welcome.
Hello, everybody. Hopefully people can hear me. My name is Fiona Hutchison, and many of the names popping through here are familiar to me. I'm the Director for Nurse Practitioners and Midwives in the Nursing Policy Secretariat at the Ministry of Health, and I have two colleagues with me, Heidi Bergstrom, who's the Organizational Change Management Lead for the Provincial Attachment System, and Tara Macklin-Smith, who's the training manager with the Health Connect Registry. And the three of us are going to walk through this presentation today, hopefully be able to meet our goals to get of the material we have and to answer your questions. Tara, we'll just go to the next slide. I want to start us out just by recognizing that the Ministry of Health does stand on the lands of the Lekwungen people. These are their ancestral and unceded territories. Presently, those nations are made up of the Esquimalt and Songhees. And I myself am calling in from Sauk, which is also colonially known as Souk, and just want to acknowledge that in all of our work every day, from ministry point of view, and I know as MPs, we very much want to work in alliance with Indigenous voices in a culturally safe way. So we'll move to the next slide. I'm going to try to run through the next couple slides quite quickly. My cat wants to be in the picture. And I'll say a few things about housekeeping. We are going to just go through our slides, recognizing there might be a lot of questions. We'll ask that if you could please put your questions as we go into the chat, and we will make sure that we get time to get to them. And if for some reason we can't get to all the questions, we'll commit to, getting some feedback back to people about the outstanding questions that are left. We have a couple of polls to do. So during this presentation, we're going to ask you to weigh in on some questions, and that will help us know where to direct our topics to make best use of your time. We're going to talk about the provincial attachment system, of course, the goals, how the process is working, what the steps are. We're hoping to do a system demo, and then at the end, as mentioned, we're going to get to some questions. So next slide. So I'm going to hand it over to Heidi, who is going to take us through some background now.
Okay, great. Excuse me, and bear with me. I've had a little bit of a cold this week, so if my throat starts cracking up, I might just have to turn it back over to Fiona and Tara. Thank you, and I really appreciate being here tonight and everybody taking time after work or in between shifts or whatever you're doing, so we'll try to make it fast. Wanted to share this slide tonight, just some background if folks hadn't heard a lot about the project and what's been going on. And I'm popping links into the chat while I go along. I've got two links here for you. One is the minister's public announcement on July 5th about the provincial attachment system. And the second link is just a recent update, actually, to the provincial attachment system report out, which has got some really interesting news in it too. So I'll put those in the chat. You can have a look at them. Basically, I just wanted to say that there's 3 different parts to this. So the first part being the Health Connect registry, and wondering if everybody's heard about the Health Connect registry. You can always say yes or no, or maybe in the chat. This is the patient-facing side of the government's action plan to strengthen primary care. And this is where patients go, they can register and try to work with us to find a provider. So if you don't currently have a primary care provider, you could submit your name or your family, members in your family as well, to the registry. And attachment coordinators will work with you as a patient, and they also work with doctors to help make that connection, and nurse practitioners, of course. So all of the providers in this space. The second piece is that provider-facing piece, the provincial attachment system, which is what we're talking about tonight primarily. And this is where we are collecting information about panels, about your capacity to take on new patients, about your medical clinic, where you're working, and all of that good stuff. We're collecting that data, and the attachment coordinators will be able to use that data as well in upcoming development sessions to actually connect everybody in one go. We actually think of the provincial attachment system not as 2 different things now, but as one big family of operations to bring patients and providers together. The third bullet down here is about panel uploads and updating the PASS. So this is a crucial activity that's underway now. It's been underway for some time. We do have a deadline coming up that Fiona is going to be talking about. And this is where FPs and NPs prepare and upload their current patient panel data and update their capacity in PAS. And they're really 2 different steps. And Tara is going to take everybody through that as well with the system demo, just showing how you get your credentials in, get access to PAS, and then be able to update your information. But the panel work is actually quite separate and distinct from all of that work in PAS. It can all be done at different times. It's not one dependent on the other. You can do any of these activities, but they are different steps. There I go, I'm losing it. And just in time to pass it back over to you, Fiona.
Yeah, I was gonna say that was perfectly timed there. So as Heidi mentioned, the provincial attachment system is really a big system that is about attachment, but there are many benefits from the provider point of view as well as, from the patient point of view. And so, obviously, as people are building their panels, there's a need to, access who is needing to be impaneled to you. And so this is just a central way of providing that ability of patients to select from, to have to see if you can, make a match that works for both sides to get patients attached. The intent here is that we're reducing the administrative burden of having multiple wait lists at every clinic by having one central wait list. And likewise, instead of having everybody's clinic constantly answering questions about, are you taking patients, or what is your wait list like, that kind of thing, this is an opportunity for 811 to handle those calls and to help streamline things. There's a number of, really awesome features of this PAS in terms of us as a province. And I say the collective us because we, as healthcare providers, as well as the ministry, just don't actually have a full picture of what's going on in the system in terms of how much need is there for primary care and how much capacity is there. We work with ballpark numbers that come from census data and other things, and those are not actual numbers. So this whole system is a way for us to have a much better line of sight on who are all the people in the province who are needing primary care providers, and who are the primary care providers in the province, and where are they located, and how much capacity is there in the system. So it very much is an opportunity to help identify gaps, plan for future needs, and so on. The other thing that I'll say about it, I see as a total benefit personally, is it's a direct line of everybody is looking at the same data, so it's a direct line to be able to show the data on who who is meeting the needs of which patients. So for example, right now, many of you will be familiar, or some of you at least will be familiar with sending in encounter code reporting, of course, and then also attachment data. If you've been working in the PCN position, I recognize that many of the Health Authority MPs here tonight haven't always been in that position, but the attachment data that's been sent in so far is attachment data that shows, goes into a kind of a black box, and you as a provider don't exactly know what the ministry is looking at in terms of your attachment numbers. This is going to be a source of truth for all comers, and I see that as a really big benefit for providers, myself. And then lastly, the One Health ID that is required for this, that you'll hear more about, is a centralized way to allow for practitioners to access services. And in that world of constantly having to submit new passwords, different credentials, and so on, it's kind of nice to have a centralized one-stop shop. So that's a benefit there. Next slide. We know, I think everybody here knows, and we have communicated out that all longitudinal primary care providers who attach patients are expected to participate in the system. There is a financial incentive for FPs and MPs to do so, and this includes Health Authority employed MPs. For those folks who are Health Authority employed, which I think basically the vast majority of the folks here tonight will be, because we really tried to aim this towards that group. Those payments will be made through the NNPBC Provincial Initiatives Program. So the ministry will be flowing the payments for this through that program. The exact process, the timeline for the payment is still being established. We're still sorting out a lot of details there, but trust us, it is coming. It will end up in the right place. And we will be having more info coming out on that. As you've probably heard, there was a deadline for all providers to complete the pass requirements by March 31st. This has been a bit of a moving deadline. It's moved a few times. In part, this latest move is in recognition of the fact that, Health Authority employed NPs and FPs potentially have had some challenges in being able to actually complete the pass work because of various system related issues to do with EMRs and privacy regulations and a number of other things that you may have heard of. And so, the deadline of March 31st, yes, we recognize that's 10 days from now, looming. Having said that, the ministry very much recognizes that people can only do what they can do when the systems are working. So we encourage you that if that deadline comes and goes, please just keep working toward completing the requirements. It's not a hard and fast, like this day comes and then all hope is lost after it. We very much want people to continue to try to get their past requirements done. And the bottom line here, and why we have deadlines, is that we really need to get as much accurate data as possible into the system within a certain time frame, such that we can then do the next phases of the work related to the system. And, as I say, that has moved a couple times. So we're a bit behind in some of the plans to move some work forward, but we want to have enough time for as many people as possible to get into the system. Next slide. So I'm going to talk a bit about the processes. We can just carry on from that slide. You probably are aware the number one thing to do right now is to upload your panels. I hope you're aware of that. In that process, basically involves making sure your panel is as accurate as possible, reading about the instructions, and I'll speak a bit more to that in a second about how to do the panel upload, and then doing the panel upload. And you can go to the next slide. The way that we will see NPs doing the panel upload in the health authorities is going to vary. And so I put right across the top here that, like, the bottom line on this is I'd like everybody please to check in with their health authority NP leads, because they have been doing a lot of background work to ensure that these things can go as smoothly as possible, helping the ministry with data that we needed to be able to make things happen. And every health authority has a myriad of different EMRs that are potentially used within its owned and operated sites and within any third-party sites related to the health authorities where NPs work. And so this slide denotes the sort of ideal state, if you want to call it that, the current state that we know we're in, and the smoothest way that we think this can be done. But I am just going to, preface all of that and end all of that with saying, whatever this slide says, please ensure this is the plan for your health authority. So you can look at which EMR you use in your health authority, or in your clinic, I should say, because as I say, it's different in some clinics from others, even within the same health authority. And if you use MedAccess Profile, MOAS, or Accuro, there is a direct way to upload your panels via the EMR. Again, I would connect with your tech teams, your NP leads, to make sure you understand how that process works. There is training and other resources on how to do those uploads, but there may be a few special tweaks that are needed within a health authority. So if you're having any issues, please let them know. If you have a different EMR, there may be a couple of other options. And again, gonna say, double check with your health authority lead to ensure this is how you are supposed to do it. But within most health authorities now, there is the ability to use a software platform called Dr. Bill. And that is one way you can submit your panel. The other way is through, in VHA in particular, through doing, submitting them one by one using attachment codes and sending that over to your billing department, and your billing department actually doing a batch upload that way. So there are a few different ways, and we can certainly answer more questions about that at the end if there are. Next slide. I'll just mention, some of you may have already done some of this work, may have looked in past, said, hey, my clinic's not in there, what's going on? Or somebody might have told you your clinic's not in there yet. We're aware of that. We're working with your health authority NP leads to get the clinic data for health authority NP clinics into the system as soon as possible. But you do not have to have your clinic showing up in PAS to do the panel upload. So it's very important that you don't think that is a delay. You can go ahead, do your panel uploads. The clinics will show up there, and then your panel will show up in them when that happens. Next slide. Okay, we have a few questions. So Alex is going to just start us off by putting out the polls, and we'll give you 30 seconds to answer, and we'll all hum the Jeopardy tune in the background. And while you have a chance to answer those, we'll just sort of give you a second, because it takes a moment for each poll to
Yeah.
kind of trigger and come up with an answer. It's amazing how long 30 seconds actually is. When you, yeah, exactly. Everybody sing it. When you actually wait for these everybody to get a second to answer, and then
This-
for the poll data to come up.
Yeah, and these polls just give us a really good idea of the folks on the call today, you know, if you've had a chance to get your One Health ID or not. Early on in the process last summer when PASS originally launched, there was quite a few folks who got tangled up in the process of how to do the One Health ID. So that's part of the reason why we want to know today too, if anybody on the call is having trouble with getting their ID, then we'd like to hear about that and make sure that you know how to do that, or you know how to get support. At the end of the call, we'll be sharing all the support information. So we'll
Yeah.
let you know that. And we had one question here, Fiona, from Gwendolyn. I just started my practice this January. Am I to upload what I have already? And I
Yeah.
replied that yes, you can upload what
Yes,
you have.
please.
Yeah.
Please upload what you have already. It might not be very many, but
Mhm.
that's okay. We at least you have what is in the system. Just to
Exactly.
clarify a bit about the upload. So the upload is basically it's just a single time event where whatever you've got on your panel right now, just put it in the system, right? If you are still attaching people, which many people are, and especially many new NPs are just starting doing that, the ongoing way that your patients will show up in PAS is through using the PAS attachment code, which we can touch on later as well. But that's basically how you'll continue to submit people, and they will show up on your panel as you submit them. Alex, do we have an answer to that last poll question? Okay, thank you. So 67% of people have it on this call and only 33 don't. So we can run through that if people think that would be useful. But it's good to know actually a lot of people have this step underway already. The next poll question, and while these are coming up, we'll just has it shot out there, Alex?
Oh, okay. Yeah, go ahead.
Okay.
Well,
While
that's
we're
coming up. We do have some more in the chat.
yeah,
So
I see.
you see, so Darcy is next. What if you work in a shared model of care within primary care with other NPs? And Lisa has the same question.
Hi. Okay, great. Hi, Darcy. If you work in a shared model of care, so are you saying you don't actually have patients who are attached to you as their longitudinal provider?
I
And
think
you can take yourself off.
specifically, like Lisa and I work together. So we work within the BC Children's Nurse Practitioner run primary care clinic, but we technically, I think some patients are attached to others, but we all see all of the patients just because, like for flexibility reasons. So I think they technically are attached to certain providers, but it's kind of a shared model of care.
Right. So the key here is basically who is designated, and you can decide that within your clinic, right? If you guys like to all see each other's patients, that's great. Lots of clinics have that arrangement. But for the purpose of accounting for who the patients are in the clinic, if you can within your clinic designate, hey, so for these however many patients it is, Darcy's the MRP, and for these patients over here, the other person's the MRP, and for these patients, the other person's the MRP. And you could upload your panels that way. If there isn't really a mechanism to do the incentive payment for this, unless the panels are, attached to providers. And, again, it's not a matter of saying that if you say that that person's attached to you, they would never see someone else in your clinic. It's just that we need to know who it has a provider. So I hope that helps. I see the second question went up and lots of people. So about 50-50 in terms of yes and no, slightly more no than yes, of doing the panel upload. So that's great to know. So for the 50% who haven't, yeah, hopefully in the next short while you'll be able to get that going, and we will look for those panels to come in. That's great. If we want to go to the next question, and I'll just keep answering the questions online while the polls go up.
I think the next one is Dana, why didn't prior attachment codes not transfer to PASS?
Sorry, Dana is saying, why didn't prior attachment codes?
Codes. Yeah.
Okay, so can you clarify what you mean by that, Dana? Because I just want to make sure I understand the question properly.
Sorry, can you hear me?
Yes, we can. I'm
Okay.
sorry about your basement. That sounds awful.
Yeah, I'm hoovering water up right now. So
Yeah.
I've been doing attachment codes since I started this PCN role last April, but
Right.
none of those transferred into the PAS system. So when I logged on there, I was hopeful that all the work I'd done in the last 11 months or 10 months or whatever would show, but it didn't. So then I have to say though,
So-
because the yeah.
Go ahead. No, go ahead. Finish what you were going to say.
Well, just that our EMR system is quite challenged with attaching and accuracy. So a lot of the billing numbers did end up helping me because I was able to go and retrieve all those because they weren't matching my actual list in the EMR. So it was helpful in that way. But I was under the impression that those were supposed to actually transfer into PAS, so we wouldn't have to duplicate services.
Did you did a panel upload?
No. So
No,
we've
okay.
been putting in attachment codes.
Yeah, I understand. Yeah. So
And
all of the PCN attachment codes that have been used. So the whole reason that we had practitioners go ahead and do like a bulk panel upload, either through the doctor bill method or through the direct EMR method. The whole reason for that was, in a way, acknowledging the fact that we want practitioners and providers to be able to tell us exactly who's on their panel from their point of view, not using whatever data is in the ministry already, because we know there's been challenges with that data, right? That's why, lots of times, like I say, goes into this black box, and then you have a list that says you have 800 people, but ministry has a list that says some different number of people. And so the whole point of the bulk upload that you can do for your panel is to make sure that the accurate patients get in there. And that's why we have this initial bulk upload, to make that easy, so that you don't have to like redo all those attachment codes. You just bulk upload it through a quite simple, nothing's ever simple when you go to use technology, especially if you're as old as I am, but through a relatively simple, thing where you export and you upload and it goes over and it gets there. Because of the new code that is going to be used, or is being used now for the PASS system, those old PCN codes are no longer applicable going forward. So once you've done your initial panel upload and you've got, you've put that, you've done it however you've done it, even if it hasn't shown up in PASS for you, you've submitted it. After that, any other patient you attach, like say the next day you have a new patient join you, they have to be submitted by using the new PAS attachment code along with the facility ID. And I can say more about that after, and we can have more questions about it. But the whole process of being able to batch upload is meant to make things smoother for you.
Just put the link to the NNPBC link on the web page there that deals with facility codes and attachment codes.
Great, thanks.
Just on that page, Dana, the link that I posted just above your comment.
Yeah, I hope that helps, Dana. And if you have more questions, I'm happy to help answer them offline too. In terms of one-to-one supports, again, a bit of a 50-50 split. That just helps us know, for training purposes, what people are really looking for. We'll go to the next poll question, and I'm gonna just see
The
the
one
next-
about the locum from Jennifer.
Yeah.
If you are a locum,
Yeah, I see it. If you're a locum for a 4-month leave, are you responsible for attaching their panel to pass?
no.
I'm going to say we're going to get back to you on that one, Jennifer. We are still working on some functionality and questions related to locums. So stay tuned. At this moment, I don't have an answer for you, but we will get back to this group on that.
Okay, thank you.
Yeah, absolutely. So when I looked at my pass number, there are 25 fewer than are on my into Excel, so I can figure out. Okay, so Kim, that is a good question, and I'm gonna ask Heidi, is there tier one, like are there one-to-one support rooms on like what to do when if you can't figure out why your list looks different than some do
Yes.
get rejected for various reasons that I'll let Heidi speak to, but you can answer that one.
Yes, and I think that tier one support can help with that for sure if you call into the Zoom room. I know because they've set up a whole process for checking clinics and being able to go into PAS to see if your clinic is there and to see if your upload is complete. As far as you know, that is one thing though. If you are seeing fewer patients than are on your clinic list, you might have to check with your EMR. That's
Yeah, we're
my
just
initial
gonna-
thought too. If a clinic is missing, then we can correct that. Tier one can actually build the clinic in if it's truly not there. And they can provide a lot of support, but I would double check too on
The other thing
original-
is usually if some of your submission doesn't get accepted, I don't know if you just
Mm.
said this, Heidi, I'm sorry, that
No.
you will get it like a rejection notification. And that will be because, like, for example, some
Teleplan.
people have in their EMRs, they have duplicate, like patients are named twice, or a patient has expired and you haven't realized that. And so
Mhm.
when it goes into the system, all that gets like eliminated, and that's why you might have less people. So, but if you didn't get a rejection notification, we'll have to look into that a little more. But I would encourage you to connect with the tier one people, because this is what they do, is we bring these questions to them and then they look into it, and then we recognize, oh, maybe there's actually some other thing happening there where you need to look into. So, and I was just about to write, I see there's a couple questions about the codes and where do you get, there's only one passcode. It's 98990. That's the attachment code for PASS. That is the attachment code everybody who's attaching patients should be using going forward now. And especially after you do your initial panel upload. Hopefully that makes sense. Sorry, I realize we're so many questions. Who found their clinic? 50-50. Okay, so 50% of people don't have their clinic in PAS yet. That's helpful information. Okay, next poll question. Yeah, and I saw the thing about, are the health authority using the same PCN code? Everybody now should be using, it doesn't matter where you work, if you're a physician, if you're an MP, if you're in a health authority, if you're on a contract, if you're employed, one code to attach, 98990. That's it. And you have to submit a facility ID with that code, where that is where it might get a little tricky, because you may need to reach out to your EMR tech support people to help you with that piece. Okay, clarify. To clarify, new people attached or discharged, yeah, if they leave, there is a remove button in the PASS to address that. So you'll be able to take people out of your panel, which we've never been able to do before. So this is a much more accurate way of having data.
Mhm.
Okay. I'll put the number in the thing. It is,
It's there.
it is in there already? Somebody put it in?
The attachment code, yeah, Alex put it in.
Oh, thank you, Alex.
The full article is linked up above too, if people found
Okay,
that.
thank you. Thank you. I'm not clear on those different AT stems, systems. Is that what Dana's saying?
Not sure.
Dana, do you want to speak to that question? Maybe she's to go deal with her wedding basement. Does a pass system dump if they're uploaded twice?
Patients
There.
that are uploaded twice.
So Kim, do you mean, are they, if you
Duplications.
upload them twice by mistake? Or do you mean if like you upload a patient and somebody else has uploaded the same patient? Kim, you want to speak to that? Maybe Kim's had to go to. Okay, do we have an answer to the demos? Okay, so I think with that in mind, let's move on then
Mhm.
to the next slide, because I think we want to get to the demo. And we can see that people are very keen on that one demo, Tara. So I think for the purpose of this, we won't go through One Health ID, but if people don't have One Health ID and they want a demo, Tara and
We have
Heidi can
videos.
speak to that. Yeah,
I'll
exactly.
put some links in the chat for folks to the One Health ID and also to the videos. So
Perfect. Just want to make sure everyone is able to hear me nice and clearly. I see thumbs up. That's what I like to see. Okay, so before we jump into two different demos that I'm going to show today based on the polls, which is how to endorse your MOA to access the provincial attachment system, as well as a provincial attachment system overview, there are some things that you need to know related to the activities, especially for those of you who have not yet had the ability to go through this process. So the first step is creating your One Health ID. Heidi did just pop a link in the chat for One Health ID. In order to complete that process, you do need to have the BC Services Card app downloaded on a mobile device. Note that you do not need an actual physical BC Services card in order to use the app. If you don't have a physical card, you are able to still log in by providing alternative identification. You'll also require the Microsoft Authenticator app on your mobile device, and this is because the provincial attachment system uses something called multi-factor authentication, which is just an extra layer of security to make sure that you are who you say you are. Once you've logged into the pass, there's some activities that need to be completed. So we have a listing for directors here. Just to further define that, we also mean like a clinic lead, a medical lead, medical director, basically whoever is the clinical lead within your specific clinic has some tasks that they need to do within the provincial attachment system to give everyone access to that clinic to be able to do their specific activities. For all providers, regardless of whether you're a clinic lead or just a standard provider, there are a few other things that you'll be doing within the provincial attachment system, including setting your panel capacity, so identifying whether you're able to accept new patients, and if so, how many, as well as a few other activities that we'll go through in our demo right now. Okay, so we decided that we're going to skip the One Health ID service. However, I am going to just show a very short video on the endorsement process, which is done via One Health ID. And this allows your medical office assistant or clinic manager to be able to log into the provincial attachment system and help you complete the various activities within the pass.
In this video, we'll review how to endorse other members of your team, like MOAs and clinic managers, to access the provincial attachment system via One Health ID. Once you have completed the mandatory profile steps and created your BC provider credential under the Start Here to Access Provincial Attachment System wizard, you'll see that the next step is the optional step of inviting others to the provincial attachment system. If you have a clinic manager or MOA who requires access to the provincial attachment system, they must be endorsed before being able to log in. To begin the endorsement process, click the endorsements button. This will take you to the endorsements page. Scroll to the bottom, then enter the email address of the person who you wish to start the endorsement process with. Note that the endorsement process can be initiated by the unlicensed staff member, like the clinic manager or MOA, or it can be initiated by the physician or nurse practitioner. Enter the email address of the person that you wish to complete the endorsement request with, then click send.
The person whose email was entered into the endorsement request will receive this email where they will click this link to log into the One Health ID service using their BC Services Card app. If this is the first time that the email recipient has logged into One Health ID, there are a few mandatory fields they'll need to complete before they can complete the endorsement. This includes their personal information, the user access agreement, which they can read and then accept, and their college license. Note that if they are an MOA or clinic manager, college license can be set to none. They can then click the Get Started button under the Start Here to Access the Provincial Attachment System banner. They'll create their BC provider credential by clicking First Time Setup and entering a password that is at least 8 characters long with at least 1 number and 1 special character. Once they've entered their password, they can click Enroll Now. They will then see their BC provider account listed on the window and can click Close to proceed to the endorsement section. Because the user who clicked the email does not have a college license, this step is a mandatory process. They'll click the endorsements button and then approve the endorsement request.
The person who initiated the endorsement will then receive an email letting them know that the second party has accepted the endorsement request. The original initiator will then log in with the BC Services Card app. Once logged in, they'll go to Organization Info, click the plus sign under the endorsements tile, and then do the final step to approve their unlicensed staff member to access the provincial attachment system. If at any time you want to see everyone that you have endorsed or been a part of the endorsement process with, you can go to the Your Working Relationships tab.
Okay, so that goes through the endorsement process. I'm now going to review as a group the various capabilities within the provincial attachment system, the things that you must do, as well as where everything is located, including user guides and additional resources. So to get us started, we'll go over some basic navigation. So when you first log in, you'll be taken to the home page here. And within the home page, under the My Clinic section, you'll see the list of all of the clinics that you're a member of, provided that you've been added to that clinic by the medical director / clinic lead. If you are the medical director or clinic lead within your clinic, you'll see that there's an option at the bottom called Search All Clinics in BC. If you want to see if your clinic has been added to the provincial attachment system, you can use this functionality to find your clinic. You're able to search by clinic name, by city, or even by that specific facility number that we've been discussing earlier on. Just to give you an idea of what this looks like, I'm going to go ahead and enter in my hometown before clicking search. And that's going to provide me with the list of available clinics within that city. Let's say that the Oxford Crossing Family Clinic is the clinic that I am the director of. I can click on that clinic name. And that's going to take me to the clinic page. You'll see that there's a lovely little button on the right-hand side here called Add Myself as Director. If you are the director/medical lead of your clinic, please click that button and then go through the process of adding your staff to the list, verifying clinic details, and so on, which I'll go through shortly. Going back to the home page, you'll see that there's a banner at the top here. My name in this instance is Justin James Carswell, and I have one patient without a clinic. So what that means is that either via the new attachment code or via my one-time panel upload process, one of the patients on that list was not able to be mapped to a specific clinic. Because of that, the patient is going to appear in this Patients Without a Clinic tab. And what I would do with any patients that appear on this list is I would check mark next to their entry, or if I wanted to select all entries in the list, I can click the check mark at the top. And then you'll see there's two options here. So if this patient was added in error, you can click the remove button and they'll fall off the list. If they are part of your panel, what you would do is you would click the change clinic button. This is going to open up a window that allows you to select the clinic that the patient belongs to before clicking the proceed button. It'll then ask if you're sure that you wish to proceed. In this case, I am sure, so I'm going to go ahead and click yes. And now that I've done that, you'll see that I no longer have that banner of Patients Without a Clinic, and I'm able to go back to the clinic page. Now, I talked briefly about the steps that you'll have to complete as a medical director or clinic lead. So let's spend a little bit of time going through what that looks like. So once I am added to the clinic as the director, like you see here, what I can do is I can click on the name of the clinic. And this is going to take me to the clinic page, and there's a couple of sub tabs within there. So the first is providers and other past users. This is the list of everyone within your clinic who has access to the provincial attachment system. To add a team member to your clinic, what you'll do is you'll click the add button that you see on the right-hand side here. And then you'll be prompted to fill out some information so that you're able to successfully add that staff member to your clinic. The first thing that you'll do is you'll search for the person that you want to add. You're able to search by first name, last name, or billing number to find the person that you're looking for. In today's example, I'm going to be adding my MOA, Agnes Phillip. I then need to tell the system what type of person this is within my clinic. Generally speaking, you would select provider, medical office assistant, can never say assistant right the first time, medical office assistant, or clinic manager. Note that if you choose the system role of clinic manager, by default, they will have the same permissions as you, the director, so they are also able to complete these director level activities. If you click another system role like medical office assistant and you wish to give them those director level permissions, you're able to do that by checking off this little manage facility checkbox. So any user that has the manage facility checkbox selected will be able to complete the director level tasks within the provincial attachment system as well. Once I have everything filled out, I can go ahead and click save. And I can now see that Agnes Phillip has been added to my list of staff who have access to the provincial attachment system. Now you'll see that there's a section here called Other Clinical/Admin Staff. This is where you're able to identify other type of staff that work within your clinic, like dietitians, counselors, registered nurses, LPNs. To add that information to the provincial attachment system, you'll click this little new button on the right-hand side. And this is going to open up a window that allows you to provide that information. So the first part I'm going to select is the clinic category, the clinical category. And depending on what type of clinical category I select, the staff type dropdown will populate with the available options. So for example, if I select allied health professional, I'll see a variety of different types of allied health professionals available for me to select. So let's say I have 2 dietitians that work at my clinic and they each work 30 hours a week. That will help me inform how I complete these next 2 fields. So I mentioned I have 2 members of staff. They each work 30 hours a week. Now you'll see here that it's total FTE. If I had 1 FTE, that would mean that I had a total of 40 hours a week of work in my clinic. But as I mentioned, we have 60 hours. So that is going to be 1.5 FTE. This is a really great time for me to mention that if you're ever unsure about what a field means or how to use it, you'll see that there's a little info icon that displays next to the field. If you hover over that with your mouse, it will provide additional information guiding you on how to complete that task. Once you've added the member or the type of staff, you can go ahead and click Save, and that will populate there. The Inactive tab is going to show anyone from this section that has been removed from your clinic. So let's say, for example, that Sherry here has left the clinic. What I would do is I would click the drop down next to her entry and I would click the Remove button. That would move her from this tab to the Inactive tab. If she came back to the clinic, I could always go into the Inactive tab to add her back to the clinic. The final step for directors to complete is to verify clinic details. So the clinic details has a wide variety of information that you need to verify, including things like your facility number, the name of your clinic, your operating hours, business email, phone, fax, all that fun stuff. There is a section on care provided that's required. And then there's also a section where you're able to verify your mailing address as well as your physical address. You're able to edit any of these fields by clicking the edit button in the top right-hand corner. Now, an important step here is once you've done all of this awesome work, so you've added people to your clinic, you've identified the other types of clinical staff, and you verified clinic details, it's really important that you hit this Confirm Clinic Info button on the top right-hand corner. It's going to ask you to verify the current accuracy of the clinic information recorded in the provincial attachment system. I'm going to go ahead and click Confirm. And what that's going to do is it's going to tell the system that the medical director for this clinic confirmed this information on March 21st, 2024. And I'm also able to see who confirmed that information. Anyone who you delegate director level permissions to is also able to click this button on your behalf. Moving forward, so now that we've done everything that a director or medical lead would need to do, let's jump into what everyone else has to do within the provincial attachment system. So once you've been added to your clinic, you'll see that there's a couple of buttons at the bottom here. The first is called Panel Sharing. The second is My Panel. We're first going to go into the panel sharing section. And what this allows you to do as a provider is allow an MOA or a clinic manager, or maybe multiple MOAs and clinic managers, to be able to manage your panel and your capacity on your behalf. So, there's been some questions today about removing patients from your panel, about, updating whether or not you're accepting new patients. We understand that you are very busy and you need to be able to focus on the clinical aspects of your role. And so we've made it really easy for you to share that ability with your administrative staff so that they're able to take care of that for you. How you would give them access to be able to do that is under that panel sharing button, you would go to the Give Access To tab because you'll be giving access to someone else. And you'll see the names of everyone else in your clinic listed. If you want to give that person permission to manage your panel and your capacity on your behalf, you can click this little pencil icon here, check off Manage My Panel and Profile, click anywhere outside of that checkbox just to save that response, and then you'll see a Save button here that you're able to select. Once you've clicked Save, that user will be able to do all of your panel settings, capabilities, and configurations on your behalf. Going back to the home page, I had mentioned another button that was available to you, and that button is called the My Panel button. Now, this section holds a couple of different types of information within it. The primary one, you guessed it, is your panel list. But there's another section in here that's quite important for you to complete. And what we call that section is panel capacity. So this allows us to know whether or not you're accepting new patients to your practice, as well as approximately how many requests you'd be able to accommodate. We use this information to share with the Health Connect registry so that they can send patients who are on that centralized wait list to you so that you can accept them into your practice. Everyone has to update these fields, whether or not you are accepting new patients. To update, you'll click this little edit button here, and you'll see that there are two fields within this section that you're able to complete. So you can say yes or no to creating or to accepting new patients. If you say no, you can leave max new requests at 0 before clicking save. Let's say though that you're new to practice, or you just have some extra capacity to take on additional patients. We thank you for that capability. We just ask that you let us know about how many people you can take at this current time. Let's say I can take about 10 new patients right now. So I'm going to update those fields as well. And then I'm going to go ahead and click the Save button. And that's going to send that information through the system so that we can begin the attachment process with patients in your community. Once you've filled out these fields, just like what we saw in the clinic page, we do ask that you confirm your panel capacity to let us know that as of today's date, you are accepting new patients and you're accepting approximately 10 people to your practice. We'll just briefly go through your panel section. So Fiona talked earlier about adding patients to your panel via the 98990 $0 attachment code, but sometimes patients fall off your panel as well. So the way to remove them from your active panel list is within your panel in the provincial attachment system. You'll select the patient that's no longer in your practice. Note that you can also search for them by name or PHN. We don't expect you to scroll through 1,000 people to look for the right person. Once you've identified the person that is no longer on your panel, you can click the Remove button, and the system will ask if you're sure you wish to proceed. In this case, I'm sure, so I'm going to go ahead and click Yes. And that patient is no longer on my active panel. I can always see patients that I've removed from my panel just by clicking this little view here. And then again, like we've seen in the other sections, we ask that on a regular basis, you do click the Confirm Panel button. And that is just you verifying that as of today's date, your panel list is accurate and correct. Now I see we are very quickly running out of time, so I'm just going to go through a couple of little tips and ways that you can get assistance in using the provincial attachment system. So you'll see that there's a Contact Us button on the bottom here. If I click that Contact Us button, you'll see that there's a variety of resources here to help me. The first is I can click on the Access Self-Directed User Guides. That is the same as clicking this User Guides button here. And you'll see a list of user guides that will guide you through the entire process. I believe we have about 12 user guides right now. I am in a test environment, so I don't have them all up here. I just have one as an example, but you would click on that user guide. And most of the user guides have both a video walking you through the process as well as a step-by-step guide with screenshots that you can follow along to complete those past activities. There's two other ways to get support. So we've talked a little bit about Tier 1 support. They're excellent. They're available 9 a.m. to 7 p.m. Pacific, Monday to Friday, excluding holidays. And you're able to reach out to them by joining a Zoom meeting, or you can dial into that Zoom meeting as well to get immediate assistance. If it's outside of those hours, or you just don't feel like talking to another human today, you are able to email your questions or need for support to healthbcsupport@phsa.ca. The last thing that I'll leave you with is how to log out of the system. And how you would do that is by clicking your avatar in the top right-hand corner and clicking log out. That will take you out of the provincial attachment system, which is especially important if you share your computer with others in your clinic. I'm just going to switch back to our PowerPoint really briefly. So we'll just go through some of those supports that we mentioned. We have the user guides. We also have the videos and those ways to access support through the Zoom link, through the email are also available, as you saw within the provincial attachment system. And I'll leave it to Fiona just to go through our next steps.
I put the links for support in the chat as well.
Excellent. Thanks, Mike.
Fantastic, Tara. Way to wrap that up.
You're
I
great.
just asked Alex, and we think this is not going to kick us off at 6. So if people are okay with like hanging on for a few more minutes, I see there's a few questions. There's a hand up. Want to make sure that we don't just end. So if some weird thing happens where the Zoom gods come and
It won't.
end this for us, apologies. And if that doesn't happen, we're just going to keep going for a few minutes, provided you can stay on. So I've been madly answering questions in the chat, lots of great questions. So thank you for that. And I think what we can do is we'll take the chat questions away and we'll get them into an FAQ and be able to put them back out for people so that everybody gets the benefit of your great questions. I see Alex has made a comment that Dana has her hand up. So Dana, do you want to ask your question? She might be torn away again from her.
No, I'm here. It
Oh, go
just
ahead.
takes me a while to turn off all the machines and find the unmute button. Sorry. So when the demonstration was happening to show like the FTE of the dietitian by the director, is that somewhere we can also do? Like I only work a 0.4 at the one clinic where I attach. So that definitely affects my attachment numbers. It's also a shared cared clinic of marginalized. And so my other question is, I put in like, how many patients I have attached minus like my total expected rostered number of what I can attach, but like I don't want 200 patients all at once, obviously.
No.
Those are great questions. Yeah.
And our clinic has specialized criteria because it's basically for street entrenched folks. So not anybody can come to that clinic. So where do we put that information, and how do I delineate how often I work and my like that sort of questions?
That's awesome. Okay, so for this system is rolled out for 6,000 or so physicians and about 570 NPs. There are 570 NPs who do longitudinal primary care, and about half of those work in the general sort of in the PCN world, doing not always, but often more generalized panels. And then about half work for health authorities, and of the folks working for health authorities, probably the vast majority are doing work like you're describing, Dana, where they're working in a very niche, for lack of a better word, population with a lot of specialized services. So I'm just going to go back to answer this from a general point of view and then talk about the more niche situations. So generally, for everybody, we recognize that, like, for example, if you're an MP and you have a attachment target because you're on a contract and you're meant to be attaching 1,000 people and you just started and you only have 200 people, that, like, technically you have a capacity for 800, but nobody can take 800 people, right? Like, what we want to know, like today, tomorrow. So what we want to know is just right now, what do you have for capacity? This is a very provider-centric piece of the picture here. So if you think in the next, I don't know, like ballpark month, I could attach probably 30 people. If that's your life situation, then you put in 30. If you think, you know what, these next 3 weeks of my life are crazy, I've got it's really difficult right now, I can't attach any, but in 3 weeks from now, I can probably start taking people again. Maybe I can take 4 or 5 people. You put in what you want, okay, of what you have capacity for right now. There was a question online on the chat about, like, what if you have a wait list? We're trying to centralize the wait list. So if you have a wait list, don't count that as your capacity. Count, like, your capacity as what do you have on your panel and what do you have room for? And there are going to be lots of comms coming about the healthcare registry for patients, how people are going to be centralizing on this wait list. So the idea here is that we won't have a whole bunch of little wait lists. We'll have one big giant wait list. There's lots of great questions out there about, like, then how do we prioritize people on that wait list? And just like you said, Dana, how do we make sure, like, I have this really niche clinic, specialty clinic, that does this particular population? How do I indicate that on there? For the purposes, I would say generally my initial thought is that if you have a real restricted criteria in your clinic about patients and it's a very niche population, I would just say you don't have capacity right now. So that then when we look at what the needs are in the system and we see that people have, like, these X complications and these types of complexity, and we know that there's a clinic over here that focuses on that complexity, then we can look at matching those up. But if you have a really niche thing, I would say for now, just say you don't have capacity for the moment. And then as things work out, we'll sort it out. But yeah, it's completely provider driven, whether you have capacity and how much capacity you have. Was there one more question in there, Dana, or did I answer everything?
I was going to add a little bit to that, Fiona,
Sure.
just to tag on. And that is that the attachment coordinators, and we'll dive into this more in future topics coming up very soon, but the whole attachment process and working with attachment coordinators across the province in, every region, they are working very closely with yourself, with the clinics, chatting with MOAs on the phone, practitioners, and understanding, people's needs on both sides, from the patient and also what can be offered in the community and what can be, provided in the community. So that's a really exciting aspect about the whole thing with attachment coordinators across the province.
And there are a couple of questions on the chat more along those lines too about that attachment coordinator piece. So that'll be good, really good. It is coming. And you'll have more of a chance. Right now, our focus is to help people to get on and using the system as soon as possible.
Yeah.
And I did write it in the chat and Heidi moved it. But I want to make sure everybody here, because it's very unique to health authorities again. Health authorities, by and large, the clinics and the clinical medical lead role, where you have to go in and put in who are all the staff and who, etc., that is being done by the health authority MP lead. So the vast majority of you folks aren't going to be needing to do that piece. That will be done by your health authority MP lead. And as I mentioned, some NP clinics in the health authorities actually don't even show up in PALS yet. So we're working hard to get them all into the system so that they show up in the first place. But again, that doesn't stop you from doing a panel upload. Dana's hands up and Gwendolyn. So I'm going to go to Gwendolyn and then back to Dana. Hi, Gwendolyn.
Hi, sorry, I'm just trying to, there I am. Hi.
Hi.
Thank you so much for this presentation. I just a bit confused just about panels. I'm brand new, so I've got about, I don't know, 56, 57 people attached, but we have 200 patients here still waiting to attach, and we're more of a vulnerable population with strict criteria. So in that case, am I saying that I don't have any room at this time while I try to attach those numbers? And then going forward, there were some great questions in the chat about like, how do we maintain, will the health registry look at balance panels for some folks that want that, or how are we going to pull out those special populations?
Yeah,
from the
exactly.
panel?
Good. All good questions. I think I would say, so if you're a very specialized clinic with very strict criteria about who you can take, and this is me speaking as a MP, just like all of you, the thing that makes the most sense to me would be that if you have a wait list right now, that you continue to draw from your wait list and you say, for the purpose of this right now, no capacity. It's going to take some time for the system to get up and running and to be recognizing, okay, who's on the healthcare registry that are really complex? How are we going to make sure we're directing people to complex patient clinics if they exist, like
Yeah.
yours does?
Mhm.
And the other big question out there is like, what is the complexity mix out there? Because, you know, we don't really want a system where all the complexity is done by Fiona and none of it is done by Heidi, right? We want
Right.
people to be able to have some balance there. So recognizing that the health authorities, you know, have this legacy of having these very vulnerable patient populations to support, and we're not trying to disrupt that or change that or anything like that. But we recognize that it's going to take some time to sort that piece out. We really wanted all the health authority MPs who do longitudinal care to be included in this because they're a big important part of the system for providing longitudinal care, and they have patients attached, so we want to capture that whole picture, right? And as this rolls out and as we discover things, you know, it's an iterative process, like so many things that it comes out, right? It's all
Right.
we're learning as we go. So I hope that helps answer the question. And I would say we'll take it back because there's tables happening all the time in the ministry. Michelle Sims is one of the NP HA leads who's been involved in some of that work at the ministry side of things. There's representatives from NNPBC. I definitely, even if you're working in health authority, would encourage you to reach out to NNPBC. I think, Alex, you can comment if you still have that feedback form for questions specific to PASS, and people can put their questions in there. We're committed to trying to get back to people on questions. And as Heidi and Tara said, we want to have future sessions to address some of these, and lots to come on this. But at the very bottom line for today, what we hope is people will go away, have a bit better understanding of the overall system, feel a little bit more confident about what they need to do next, especially in terms of getting their panels uploaded, recognizing that there was a question in there, like, once you do the upload, the panel upload, whatever the mechanism you're going to do, it's not necessarily going to show up and pass right away.
Yeah.
It will take some time. There's lots of uploads happening all the time. And so you can imagine, you know, when your computer does the wheel of death, like it does take a little while for all this data to transfer. And that said, in the health authorities, there's even this added layer of complexity in that all of the, not all of the, but some of the clinics don't even show up in PAS yet. So your data is not going to show up in PAS, even if your clinic isn't in there, but you can still do the upload.
Yeah, and you can still do the work, the activities in PAS. So if you know already right now, well, you know what, we have room for 5 patients, let's just say. You can go into PASS and you can
Yes.
update your capacity and say, okay, today we have room for 5. That's what we can commit to safely, comfortably. Can
Even
also
if your
update-
panel hasn't shown. That's what
even
you
if your
mean, Heidi.
panel hasn't
Yes.
shown, exactly.
Yes.
So it's not mutually exclusive that way. You have to go in, do your panel, and then go into PASS, and you can also do that. Or you could do it in the reverse, go to PASS first, then go do your panel. It's quite
Yeah.
all right either
And
way.
the only caveat to that is for NPs whose clinics haven't shown up in PAS yet, you just won't be able to do the log into PAS and find your clinic and all that piece because it's not in there yet. But we are trying to get them in there as soon as possible. And I would encourage you just connect with your NP leads to say, hey, is my clinic in PAS or not? Do you know? You can go and log in and see if you can find it. That's how else
Yeah.
you would know.
And that's part of it too. So start the login process, get your One Health ID, endorse right at the beginning, endorse an MOA or other people, excuse me, and try the login. If you get hooked up, if you get stumbling, you get a barrier, just contact the Zoom room. They will, like that, get you in.
Great. I'm not sure how many people are still online. I see that the chat has slowed down and the hands aren't there, so I think we're gonna let everybody go
Okay.
and have a nice evening.
Thanks
It's
so much.
6:15. Thank you so much for such a great turnout. Tell your friends. This is gonna be recorded. They can listen to it. We are gonna do other sessions, so stay tuned for those. And yeah, feel free to reach out with questions anytime. And I think what we'll do is we'll take away the questions from here and condense the answers, and then send them back to your health authority NP leads and they can share them with all of you. Bye, everyone.
Bye. Thank you, Fiona and Heidi.
Thank
Coming.
you.
Thanks, Alex, for hosting.
Yes,
Anytime.
Alex, thank you. Awesome. Great
Anytime.
work with
everyone.
those polls.
Yeah.
Yeah.
My first poll session.
It was great. Rocking. Thank
You're
you.
rocking.
Thanks,
No
everyone.
kidding. No
I'll
kidding.
get the
You're great.
recording over soon.
Okay.
Thank you.
Awesome.
See you
Thank
guys.
you so
Bye.
much. Okay, have
Good
a good
night.
night.
Bye.